Senate Health Appropriations Subcommittee to order, and appreciate everyone being here at this late hour. I don't know how many won their sports bets yesterday, but it wasn't me. Anyway, we're going to let Chairman Kirkpatrick bless this meeting for us.
Dear Heavenly Father, thank you for this beautiful day in Georgia, this beautiful sunrise this morning that we all got to see coming in. And be with us as we make important decisions for 11 million Georgians and give us strength to make it through these very long days. In your Son's name, amen.
The doctors in the caucus are used to 7 o'clock meetings, so we're all here. I'm sure we'll have a few others kind of wander in. We're going to hear from Commissioner Ogle in Community Health first. If y'all want to come up front and introduce your team. And we're focusing today mainly on the House changes to the amended 22 budget, so just to ground everybody. Good morning.
Morning.
I'm Kaylee Noggle, Commissioner. With me is Rich Kim, our Budget Director. Also back with us is Ryan Loke, our Deputy Commissioner and Chief Health Policy Officer, Joe Hood, one of our Senior Advisors, and Brandy Sylvan, Director of Government Relations. And I think I saw Caitlin Ward of her team also walk in. So happy to be with you this morning. You should have a presentation, hard copy hopefully in front of you. We are happy to answer any questions in the budget, but I'll really just talk you through the changes between the governor's recommendation and the House version. And so it means that we'll skip a few of the first slides and jump to page 7, tracking number 88.2. In one of the benefit programs, Medicaid, age blind and disabled. The first change is 88.2, reduce funds to reflect an extension of the enhanced FMAP during the COVID-19 public health emergency. Since the governor issued his budget recommendation in January, the federal public health emergency has been extended. So we know that the FMAP, the increased FMAP bump will stay with us for another quarter. And so the House has essentially taken that extra savings up to $105 million. At 88.9, they've added $26.2 million to increase funds for a $10 per patient day add-on payment for skilled nursing centers. That presumes that would be backdated to July 1, 2021, pending CMS approval. And then at 88.1, utilize existing funds from our budget for skilled nursing centers to update their GLPL, or general and professional liability, and other insurance and taxes pass-through rate. Essentially doing something similar, going between now and June 30, but backdating back to July 1 if CMS will approve it, moving to their 2021 audited cost reports. So those cost reports will be audited later this year, probably by, I think we believe early this summer, September-ish. And so once those numbers are audited, we would go back and pay at that higher rate for the prior year. And there should be existing funds within our budget to do that currently. In the low-income Medicaid benefit program at 89.2, a similar change to take the additional FMAP savings as a result of that extension, up from $201 million reduction to $246 million. And then transferring some of those funds at 89.6 from low-income Medicaid to Peach Care to meet projected need, and we'll talk about that coming back in a moment. In that Peach Care program, 2 changes at 90.2, reduce funds again to reflect the extension of the FMAP, but actually using a little bit of that savings to stay in the program, at 90.3, and then transferring in from low-income Medicaid $13 million. So there's a swing in that program from a reduction of 7.7 to an increase of 22 million. And really that's to meet projected expenditures. We had one particularly large claim come through for a Peach Care child for a lung transplant that really threw out projections. As y'all well know, those are not inexpensive procedures, so that one kind of threw us off. And then just to account for some rates that CMS approved to be reprocessed this year. So that'll cover those expenditures. In state health benefit plan, Two changes, 91.1, the governor had recommended transferring in funds from ABD of $179.9 million. The House has increased that by $50 million to $229 million. And then at 91.2, just a yes item to instruct the plan to begin using specific FDA-approved medications for the treatment of obesity, which kind of works in conjunction with some of our new benefit that was added for Plan Year 22 for obesity surgeries, bariatric surgeries. And those are the only changes in the amended budget. In total, the governor's recommendation had added about $6.4 million overall to the budget. The House version is a net reduction of $6.9 million for about a $13 million swing. Again, most of that from those additional FMAP savings. But happy to answer any questions on these or any of the items in the budget.
Chairman Watson?
Number 4. Just point of clarification, the bariatric medicines and bariatric surgery, where are we with bariatric surgery here?
I'll let the team correct me if I'm wrong, but that is a new benefit that is being offered for 2022. So beginning in this January, that's now as a covered benefit.
Okay, great, thank you.
Thanks for your review, and as Commissioner mentioned, I asked the agency mainly to focus on the changes from the governor's budget. I think everyone was here when they presented in the joint committee earlier in the session on their overall governor's changes. Couple things I think might be worth discussing just because of the world we're living in right now. Number one, want to thank you and your department for all the work that you've done during the pandemic. I know your agency was very involved with the staffing supplements that the governor provided to rural hospitals, or all hospitals for that matter, and nursing homes. And I know that program was obviously very challenging to manage. And Joe, I know you were and I guess still are in the weeds on that one. So again, thank you for all that work. I know from our facility, it was very, very beneficial for our ability to keep patients at home when we had no other place to send them. The other area I think is probably worthy of some discussion for the members of the committee is, we've been dealing and concerned about the surveys in long-term care, and I know you all have had some conversation with CMS about that, and it might be worth
Sure.
letting the other members of the committee know kind of where we are with that situation.
Absolutely. So our long-term care surveys in the Healthcare Facility Regulation Division certainly been, a challenge. The challenge has continued. We're obviously grateful for the money that was added in the 22 budget for both additional contract funds as well as a number of positions. Obviously, with the workforce the way that it is, hiring those positions has been a challenge. I think we hired about 9 new RNs last year, maybe 7, but we lost more than we hired. So it's kind of a revolving door. We were very fortunate to, and Joe did a great job managing the COVID-19 staffing augmentation, but it speaks to the challenges when we're hiring RNs at a staff level for the department, as many of the hospitals face as well, but can go do contract work at a much higher rate, and we're almost competing with ourselves. We will have some lapse funds there we've shared with Keith. We are hopeful that we'll use the contract funds. We've identified a third vendor that believes that they will come on within the next month, hopefully, and can start picking up some of the contract workforce as well. We'll obviously be working through the vaccine requirements for both the contractors and our own staff, but aren't expecting any significant issues there. The feds, CMS has also granted us a number of flexibilities. We're kind of working through what that number looks like, but it'll essentially reset the timing of those surveys. And while we need to get out and get caught up on, quote, the backlog that's been present for a couple of years, officially CMS will kind of reset the baseline for what those are. So we'll start over this year, and so long as we can maintain the number of surveys we need to do within this federal fiscal year and state fiscal year, will essentially be back to a current status for those recertifications and continue to focus on the IJs and the complaint surveys as well.
Thank you. Another area, obviously, the House added some funds for the long-term care. I think last year, House and the Senate stood up a new quality program in the nursing home industry. Would you kind of give us a summary of where we are with that and how it's going?
Sure.
From an implementation standpoint?
Yeah, so we have designed that and submitted it to CMS for approval. I think we identified about 4 quality measures that align with our overall kind of state goals that will measure long-term care, skilled nursing facility, not only their performance, but their improvement year over year. So year one, we'd essentially identify benchmarks and then pay those incentive payments in the following year based on their percentage improvement in comparison with other peers. So that's pending with CMS for approval. I don't think we've gotten that back yet. Nope, still pending. As soon as that's pending, we'll get those first year payments out, and then likely looking at updating those performance measures and payments probably twice a year going forward from there. But we're hopeful that that incents not only quality, but the improvement in quality annually as well.
Yeah, and I know you guys engaged some consulting work to try to help develop that and make sure it was kind of a living program that made sense from a quality standpoint. And I appreciate y'all working on that. That's kind of a passion for me. Chairman Watson?
Yeah, just to pile on here, it's great to hear. Because you've heard us say so many times, quality, quality drives care, and it also drives price. So if you improve the quality of care that we do in healthcare, really no matter where in healthcare, but not only does it make the patient better, and all the other things that go along with that, including regulations and so forth, it drives price also. So that's great to hear. Congratulations.
All right, any other nuggets, words of wisdom?
We appreciate you. We look forward to coming back and talking about 23.
Absolutely, it's a lot more sexy to get to the big budget.
Hopefully not as early.
Agree, but in my mind, on something like this, boring is actually pretty good. So we appreciate the fact that we're not talking about anything that's a hot topic. I want to thank Keith and Brent for their work on Senate budget and for arranging these meetings and all the work they do to support the subcommittee. And I think we've got some folks from the Healthcare Workforce Board to come up next. Director, appreciate your being here. Can I introduce yourself? And if anybody from your team is here, we appreciate your stepping into a difficult position. And, I know that this subcommittee in particular is very, very interested in the work that you guys do on the graduate medical education front in particular, and trying to keep our healthcare workforce up to speed. And right now we're having a challenge, obviously, in the staffing of all of allied health, nursing in particular, but I think most hospitals would say all the allied health positions are becoming particularly challenging, and so we will need to be working with you and your board trying to solve some of those problems. So welcome to the subcommittee meeting, and appreciate what you're doing. If you would, introduce yourself and your team, and let us know what's on your mind.
All right. Well, thank you for that, and good morning. My name is Freeman Montague. I am the Budget Manager Director for the Georgia Board of Healthcare Workforce. As Mr. Burke mentioned, of course, we had a very tragic loss. So for the time being, I'm filling in. We are currently interviewing, including actually today later on, for positions for that department. But for right now, for budget hearing purposes, I'm representing the department. I do have Abrielle Beckham. She is our new hire. She's our outreach coordinator. Actually, right next to her is outgoing outreach coordinator, Daniel Dorsey, who's moved on from working in finance to, I think he has a new position now with the Composite Medical Board, and also technically right now the interim executive director for Composite Board is actually Michaelyn Hughes. So she's sitting right there. So they were actually not on our team, but they are sitting with us, so I just thought I'd introduce them also.
I appreciate that.
Sure, no problem. And so just to clarify, the handout that you all have in front of you right now, this just touches on the governor's recommendations for AFI 2022. But if you do have any questions about some of the changes that you saw in the House bill, I'll be happy to answer those also. But just to get started, it's 92.1. The governor's recommendation is to increase the funds for a $5,000 pay increase for full-time benefit-eligible state employees to address agency recruitment and retention needs, and that is for $24,234. And so that would bring the total for admin for FY22, were it to pass as it is, to $1,036,365. And that is actually the only item the governor recommended for 22. But as I mentioned, if you did have any questions about some of the House changes that were in FY22, I'd be happy to answer those.
I think they're on page 11 in your tracking document.
No, I was just going to ask you to highlight the House changes, if you
Sure,
don't mind.
no problem. So there were 3 House changes. The first is 93.1, and that was asking to change the slot increase to $1,741,888. So that would be 93 additional slots. What is in the budget currently is for 136, and the reason that there is that ask for 1.74 million is LaShawn Hughes, the prior executive director, was working with Denise Cornegay in the Summit Committee. There was a year, I think it was the past fiscal year, FY21, we didn't have any new additional slots for GME funding, and so that was what they proposed to help make that those slots whole. The other change was 94.1. It was reducing $500,000 from Mercer's budget, and my understanding from that is currently Mercer had been granted $500,000 to hire 2 medical examiners or forensic pathologists, and they were not able to fill that position, and so they were asking to have that fund reduced since they would not be able to find someone to fill it. And the last change from the House bill was 95.1, and that was adding $500,000 for a nursing program for Mercer.
Now, that ad was actually in the Morehouse, wasn't it?
Yes.
5.1.
Mm-hmm.
Okay.
Yes, 500,000 coming from Mercer because they're not going to use the medical examiner of 100,000 to Morehouse to add the nursing.
Chair Lady?
We worked together on the Senate Bill 340 to try to improve our ability to add residency programs around the state by removing the 50 number requirement. Do you anticipate that that's going to result in additional requests for 23?
Oh, that's a good question. I don't think so, but I'll double check and research that for you. That's a good question.
You might want to be prepared for that when you make your presentation. Thank you.
Yeah, I think we have had some new additional residencies that are being formed, especially in rural Georgia, that I suspect there'll be a bump up in that area. I'm not sure if it's related to that or just the growth that is occurring in rural residency programs right now. I think we are actually getting some traction in South Georgia on some of those programs, especially in psychiatry, which is nice to see. Well, I think, we've got a lot going on that would affect the healthcare workforce board going forward over the next month or so before we get the 23 budget. So look forward to working with you guys on that. And I think the exciting part is everybody is focused on trying to find some solutions to these challenges. The medical examiner area is one of those, but obviously the frontline workforce is another. And appreciate the work you're doing in difficult circumstances, and look forward to working with you guys going forward. Any closing remarks? Anything you?
No, thank you. Of course, any assistance you think you may be able to provide, of course, hopefully you have my information. If you don't, you feel free to reach out. But thank you. I appreciate your patience and your help.
Okay, great. Any other business that anybody has for the subcommittee? That's finishes up our agenda today. Appreciate everybody coming, and if we have any further questions as we go through this budget process, we'll be in touch with you guys.
Thank you.
This meeting's adjourned. Thank you, everybody.
Thank you.